Tonight, the Troubleshooters follow up on a mother's mission to improve the state's mental health system. Judy Kelson Murray says her son was mentally ill when he drove his car into a gas station in East Haven last month, but she couldn't get him the help he needed. Troubleshooter Jeff Stecker took a closer look at what happened and what's being done to improve the system.
When a car went up in flames in this crash at an East Haven gas station in May, it might have appeared like an accident. But witnesses told police that the car was already burning before impact. And when Judy Kelson Murray found out it was her 23-year-old son behind the wheel, she knew it was intentional.
He probably left 15 minutes after I did with a can of gasoline and a propane tank in his car.
It was the end of a lifelong struggle with mental illness for Daniel Kelson. At 13, he was diagnosed with bipolar disorder. It started with mood swings, from the happy, kind boy his mother knew to an inexplicably angry child she couldn't understand. Judy says in the last few years, things got worse.
He was progressively getting angrier and angrier. He was hearing the voices all the time. His friends and I knew when he heard them, he would just sit there and stare.
Daniel told his mother those voices urged him to kill himself. In his teens, he saw doctors, therapists, and took medication. But once he became an adult, Judy's hands were tied.
I couldn't speak for him because he was over 18, so no matter what I did or who I called, hotlines, doctors, hospitals, his own therapists, he was over 18.
In early May, a judge committed Daniel to Yale New Haven Hospital. He stayed for 10 days. Judy says she was told by the hospital that Daniel was being discharged because insurance would no longer cover the stay, and she couldn't afford to pay cash. He was still hearing those voices.
The very night he was home, he told me he was very calm and clear, and he said, "I can't watch this anymore. What's going on in this world?" And he said, "I'm going to make a statement."
A week and a half later, with a propane tank, gas can, and lighter, Daniel ended his life.
We as a society in Connecticut pay a price for not paying attention to the public health burden of early onset mental illness.
Dr. Daniel Connor is a child and adolescent psychiatrist at UConn Health Center. He's also co-chair of the Task Force on Behavioral Health Services for Young Adults. That task force was convened after the Sandy Hook shootings, where 20 young children and 6 adults were gunned down by Adam Lanza. Revelations of Lanza's behavioral health issues sparked calls for a hard look at how mental health is treated in Connecticut.
I think the big issue that got accomplished is to bring the problem, the public health problem, the public health tragedy of adolescent and young adult mental illness out from behind the covers into the open.
This week, the task force is releasing their final report, 47 recommendations they are turning over to the legislature. They range from finding ways to identify mental illness sooner to having enough healthcare providers to treat it. The 13 task force meetings brought together clinicians, treatment providers, and the insurance industry, and at times the conversations were heated.
But if we're going to persist in these myths, don't expect $250,000 or $250 million to change a public attitude.
We sat down with 3 of the task force members representing different sides of the equation.
We absolutely spoke about over and over again was the gaps if you're privately insured.
Patricia Reamer is commissioner of the Department of Mental Health and Addiction Services. She says parents often find it difficult to connect all the necessary services to provide the care their children need.
And people still are falling through the cracks because I don't think the array of services that is offered if you're privately insured are sufficient to meet the needs of everyone.
I had trouble navigating the system from day one. The rules, the laws, you can't do this, you can do this.
And Melissa Dowling is Deputy Commissioner of the Connecticut Department of Insurance. She has insurance companies at the table and says between new laws and commitments from insurers, these companies are doing a better job at treating mental health.
I think there's a lot of frustration built up from decades of, just poor treatment, bad decisions, and we really have to look at what's happening going forward from 2014 because so many things are changed. The laws are stronger, better, and more supportive.
Whether it's private insurance or public coverage, this package of recommendations is complex and won't come cheap. In 2012, an estimated $526 million was spent on behavioral health costs in Connecticut for people under the age of 25. Putting the task force's ideas into policy will cost far more, but many on the panel say without major change, the costs will be even higher.
There's no way you're going to get out of this without some cost. Pay now, pay later. Your choice.
Now it's up to legislators to choose what they think will work if the state can afford it and what demands they'll make of the insurance industry. Judy Kelson Murray plans on making sure that lawmakers know about her family's struggle and loss. It's the promise she made to Daniel in the final hours of his life.
He will not die in vain, and I will be his voice in a positive way and help to change the system.
With the NBC Connecticut Troubleshooters, I'm Jeff Stecker.
And the Troubleshooters reached out to Yale New Haven Hospital. The hospital declined to comment, but we did hear from Daniel Kelson's insurance company. Anthem released a statement saying, quote, "The death of Daniel Kelson is tragic. Our thoughts are with his family at this difficult time." Anthem Blue Cross and Blue Shield provided coverage for the behavioral health services recommended by his treating providers.